Hello, can you guys hear me?
We sure can, Mr. McClure.
Okay, good.
I'm glad you were able to get in.
I may try to see if, well, anyway, I'll just use it this way.
Okay, sounds good. We're hearing you very clearly.
All right, good. Thank you.
Uh-huh. Mr. Roden, you should be live and ready to go anytime.
Hello, can you guys hear me?
We sure can, Mr. McClure.
Okay, good.
I'm glad you were able to get in.
I may try to see if, well, anyway.
Mr. Roden, I'm not hearing you. Are you talking?
No, we were actually hearing feedback from Mr. McClure's other previous conversation, so we were at a pause.
I may try to see if, well, anyway.
Is he on more than one source?
Let me, hold on just a second, guys. I believe I've got a double one going.
Okay.
Mr. Roden, I'm not hearing you. Are you talking? Sorry, guys, you're getting a delay from it.
Mr. McClure's other previous conversation, so we were at a pause.
Is he on more than one source?
Let me, hold on just a second, guys. I believe I've got a double one going.
But it has the H breakdown. We're ready?
I think we've got everything up running. We're live. I will call the emergency board meeting, the Ashe County Board of Education, to order for August the 13th, 2021. I will start first. If you all will, we'll start with the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I may be a tad out of order, but we'll go roll call next. So I'll start to my right, Dr. Ken Simmons,
Present.
Vice Chair Diane Elder,
Present.
Chairman Josh Roden, present. Ms. Polly Jones.
Present.
And we have online with us Mr. Keith McClure.
Present.
Thank you. Everyone's here. We'll start this meeting. I called an emergency meeting together to discuss our COVID numbers that we are having come in and some quarantine. So I don't know, Dr. Cox, do you want to kind of give us the latest update of these numbers that you've presented for us here?
So as you requested, we are looking at our numbers on a regular basis since the board voted nearly 2 weeks ago. And we have seen a sharp increase in the numbers of students and staff who are both positive with COVID and or quarantine because of COVID. And those numbers are rising sharply right now. I printed off the numbers before you all, so you have it in front of you. And as a summary, we have currently, and again, we're not back to school yet, we have 17 students that we know of that are positive, 56 students who are quarantined due to being a close contact of a positive. We have 7 positive staff members and 1 quarantined staff member at this time. And of course, those are what we know about. Students aren't back in our underneath the schools yet, except in the cases of a couple of our sports teams. But these are elementary and middle and high school students across the district who have been reported to us, knowing that the first day of school is coming up on Monday.
So the board has those that are present, have those printed out for there. Also want to talk a little bit about the quarantine protocol procedures that we have. Those were printed out for the board here. And I think it would be good as we kind of would talk about these, so the parents that we have listening to us today kind of have the most updated information that is what they're looking at and for the board to approve. So I guess, how do you just want to go through what we're looking at as far as quarantines and kind of go through the list here? What's the board's preference?
Well, these guidelines are essentially what, in conjunction with the health department and our school nurses, they spend quite a bit of time diving into the North Carolina Strong Schools Toolkit that saying what we should follow. And these guidelines are essentially what is in that toolkit, with the exception right now, because we couldn't guarantee that everybody's masked. We do not have anything about. Anyway, there's some additional things that we could put into place if all students are masked under this as far as quarantine.
And it's just a question for me. It is my understanding that the toolkit that the state provides is referencing an all mask school system.
Correct.
Correct. Okay. Any questions?
Well, my biggest concern, Mr. Chairman, is the fact that we are going to have kids in quarantine for many, many days. And the toolkit allows some other options. And it bothers me that we already have some students that won't be starting school because they've been quarantined, and none of those reports to the families are consistent. They're getting different information from the us than they are from the health department, different dates, different levels of quarantine. And so I really want us to make sure that we nail this tonight, because I think we're going to be we already are looking at quarantines and how that will affect our children, regardless whether they have COVID or not. Actually, we've got one student who got to go back to school at 10 days, even though she tested positive. Another one who is negative, that was exposed, has to wait 14 days. So we need to be consistent with what we do. And we need.
Ms. Eldred, when it comes to COVID, they do have a shorter quarantine period, and that's CDC guidance.
Well, that's crazy. I mean, that's just crazy that you have COVID and you can go back to school before someone who tests negative 3 times. It's just crazy.
Well, that's not without a test, so there are lots of rules, but I just wanted to.
Sorry, I've read all the rules. Thank you. I've read all the rules. I have studied the rules. I have gone over them and over them and over them. These are guidelines. They are not our rules if we choose not to follow those rules. Okay, they are guidelines. And there is only one that I know of that we have to do, and that's the bus one. The rest of them are simply guidelines. Okay, so I just want to make that clear that I do want these kids safe, but I also want them in quarantine less time as we can give them, because we are interrupting instruction when they are quarantined. And do we have a plan for how we're going to address their instruction while they're in quarantine?
Yes.
Well, that plan has not been presented to some parents who will be quarantined on Monday unless something changes. So it's Friday, so they should have a plan in place, but no one has contacted those folks.
So I will make sure that the principals have their teachers aware. I knew that Amy was busy getting out Chromebooks to some of the students. Some of these are brand new quarantines, so they've just come up over the last few days. And so we have to contact their teacher. Their teacher has to prepare special lessons in advance for the students. And then we, because they're in quarantine, have to make arrangements to safely get student work to them if they do not have a device. So our teachers and our principals today, we're in the process of figuring out who had a device and who did not, so that we could get electronic assignments to students. But a lot of this is brand new. So you have a kindergartner who may not have physical work on the first day because we have 9 kindergartners who are in quarantine. They wouldn't necessarily have a book or a worksheet or something to send home yet, because most of the time in kindergarten, they are getting to know each other. So our teachers have to develop assignments for students as they come up. So the first, week of school is going to be tough when kids are in quarantine, regardless of where they are, and that's not intentional. It's just really tough because we'll learn of someone Sunday night, and that doesn't mean that the teacher will know until Monday morning that they have a child in quarantine. So it'll take time to actually get a lesson to that child without a device. Now, yesterday, our elementary schools had a deployment planned, and the storms forced them to all not deploy the laptops because it came through with a fury. And we had some electricity out and had some flooding. And so we talked today, principals and I talked today along with the directors to get a plan in place so that they could meet families where they were to be able to get the devices. But because we had to cancel an evening event, that means getting things in place throughout the next week. And so each of the schools will be communicating when parents can get the devices, and they all said that they would be flexible this week to be able to do that. And of course, following COVID protocol. So if for someone's quarantined, they can't just take it over to their house. We have to be able to safely do a drop. And we don't really want to put a device on a child's front porch without knowing that they're going to get it in place. So there are a lot of different moving parts that are different for each situation for families. So we're really working hard to do it. But when you have, right now we have 75 students and their families that are either positive with COVID or quarantined because somebody in their family has COVID or because they've been exposed as a close contact for COVID. That's a lot of different individual circumstances that our teachers and our principals are dealing with right now, and our nurses. So, I mean, I know it's not ideal, but we're doing the best that we can to make sure that people get what they need. And again, some of them are books, some of them are devices, some of them are, I said, make contact, a phone call, get to know your student. But that's on top of, they can't do that while they're teaching in class with other kids present. Zoom links, I mean, some of our kids don't have Zoom links set up and, we haven't had school yet. So it just complicates things.
Okay, but are not any of those measures that we were under for a year and a half pertaining to this situation?
Yes, however, you've got a new teacher with new students, new contact information for students. As far as getting information to them, a Zoom link is unique to that teacher. So when a teacher sends out a Zoom to get into a class, it's from that teacher. So they may have had some information from the teacher before, but it wouldn't be for their current year's teacher. So a lot of those protocol, while they are in place, without someone being present, it just complicates things. Sometimes it might take a little bit longer to get to know what exactly that is. So I know our teachers have been busy sending out remind messages to all of their students and preparing for that first day. But, some of these, you've seen the sharp increase of students in quarantine or who are positive. A lot of them came up today and they were after 5 o'clock. So they're not going to get a contact from their teacher until probably Monday afternoon. Just being realistic of timelines and when, what happens when school starts. Now that they've been contacted probably by the health department and we've gotten their name and information through our school nurse, but to get an assignment to them is just another step outside of the health. So we do have protocol, but we also have not had a day of school yet.
So clarification on something that you said earlier, the toolkit, did you say that the recommendations, or did anyone say that the recommendations for the toolkit only applies if you are mandating masks?
I mean, I mentioned that earlier, assuming because it did come from Raleigh and came from the governor's office, and that's what they are wanting at the moment.
That's their
That's their
recommendation is
recommendations.
mask, and then they have. So is there recommendation for quarantine? Is that separate from the recommendation for mask? Like they have a recommendation for mask, they have a recommendation for quarantine, they have a recommendation for cleaning protocol, or is it a recommendation for quarantine based on if you're following all mask protocol?
So yes and no. And Jamie, is Jamie on with the nurses? Jamie can come in here and say.
Are you
I'm here,
following?
Dr. Cox.
Okay, so the question is specifically about the toolkit, and there are different, whether you're wearing a mask or not, whether you're 6 feet apart or not, there are different scenarios, and that's why it's so complicated. And it's not if one person is wearing a mask, it's if both are wearing a mask, and then it doesn't apply in sports.
Correct.
So I knew that Reagan was going to be on here, but she was having some electricity issues due to a storm. maybe you can answer their question.
I can. So the guidance, so this toolkit's been updated several times. It actually had an update on the 10th, but the only difference on the 10th from the 29th of July was just very few things in the wording. You know, nothing massive changed. However, Dr. Simmons, your question is, it goes through and it just says schools should, meaning that that's the recommendation that we're given. And so anytime we see that, those recommendations from NCDHHS are coming directly from the CDC guidelines and recommendations. So put into a school setting, and then it breaks it down by transportation, masks, and then how those things work. So with quarantines, the quarantine time depends strictly on what that circumstance looks like. If we have 2 unmasked children, this is what happens. If you're close contact and both of you are wearing a mask, this is what happens. If you are close contact and one person is vaccinated, this is what happens. And so we work very closely with App Healthcare. We have a team of nurses. We meet weekly. So the school nurses, the App Health team, Roy Putman and myself met several times this week, and we've come up with what we in Ashe County are able to do within those guidelines to keep our children safe. A couple of the things that I'm sure you're hearing are different with quarantine times have to do, if it is a sport and there was direct physical contact, there are things that we have to do. And then, yes, we may get a negative test back for a student, but it says after that, even after the negative test, the child has to remain masked and 6 feet away through that 14-day mark. Well, I don't know any sport that we can guarantee that that's going to happen. So our guidance has been that if the child is not vaccinated and they get a negative test, we're going to work and try to get, we've revised some things as of yesterday, but we were going strictly on what was in that toolkit, which is our guidance and with recommendations from App Health. So I know that was a long way to say an answer, but I may not have even answered what you were asking.
So let me give you a scenario, because I think at the last meeting, it was important that we empowered. Well, I think a part of making the decision is we wanted parents to have the decision. And that's what we voted on, that parents had the decision on students wearing the mask. So I think as a parent, if I knew that if my student was wearing a mask, I make the decision, which I wish everybody would make that decision. It was their decision. I wish they make the decision to wear the mask. If they knew that if the 2 people, the person with COVID and let's say their child, if their child was exposed to that person and both people had on masks, the CDC guidelines say they would not be in quarantine. Is that correct?
Yes, ma'am.
That's not reflected here.
Okay, well, it's not written in here because we were not able to guarantee masks. And in a school setting, when we're not watching for masks or not, because our guidance was mask optional. So the only way we can guarantee and to prevent the spread to other students that they may have been around in that school setting, we would not be able to guarantee that they were both masked at that time. So there's no video in the classrooms to be able to watch it like there is in sports. We've had to go back and watch video to see who touched somebody else or who was close to somebody else for a period of time. And so you notice we didn't address that in this guidance because we were under guidance that it was mask optional. So until we could guarantee that both people are wearing a mask and that they were 6 feet apart, then I don't know that it's realistic for us to go back and ask a teacher who has 140 kids during the day in a high school, is mainly who we're talking about. It might be easier in a first grade classroom where they can spread out more and they know that, everybody's wearing a mask and you see the same 16 kids during the day. But then we're asking our teachers to police for 15 minutes over a 24-hour period if they had their mask on. And of course, lunchtime, if they have their masks off during that time, if they're sitting a little bit close to each other, then they would be vulnerable during that time. So, I mean, there are just lots of different scenarios. So we're just trying to make the best of a really terrible situation when it comes to COVID-19.
Okay, I'd like to ask a question that's stupid from my part, but what is the purpose of this meeting? Are we going to stay? I want one thing clarified to me. Are we staying with mask optional and just discussing these other things that come under mask optional? Or are we considering to make mask a mandated order? What is the purpose here?
Well, I wanted personally some more clarification on these protocols that we just received yesterday
Okay.
on these COVID protocols. We've not seen any of these protocols. Our last meeting, our health director from Alp Health did not answer our questions. I will be blunt.
What
She did.
question?
We asked her about quarantines. We did not receive the answer on quarantines about that. And I think, because in my research, we're finding some conflicting things with the toolkit and with what we had here on this. And I think before we end up with procedures, because in my eyes, this procedure should be a policy. If we're looking at it this way and the board governs policy, then we need to make sure that the full board is on board with this, and a decision could come to change that decision. I don't know. That's up to the board.
But I think you need to, my personal opinion is, I think we need to decide, are we going to stay mask optional? Are we going to mask before we decide all of these other things? Because at the last board meeting, we listened to 2 doctors from Duke, pediatric doctors who teach at Duke in Carolina. We listened to Jennifer, we listened to the CDC guidelines, and they said the only way to stop the spread of COVID and the Delta variant was if everybody was masked. Now, Wilkes Community College, all of their students are masked. Are we going to let our early college students go over there mask optional, even though everybody else over there is masked? I think the first thing we need to decide is, what are we going to do about the mask? And then we talk about the quarantine. That's my opinion. And I know parents want to go. I know it's a hot debate out there. But according to all the things that I've read and all the people I've listened to and all the news I've seen on television and read the different magazines that come through my house, Time, Newsweek, all these things, the only way to keep your child safe is if you wear a mask. Washington County, 1 week, 30 kids sick. So I think that's a decision that we have to make before any of this other stuff even becomes important.
Well, actually, Polly, as for my decision on what we need to do about masks, I've done a lot of independent research, and there are as many people out there that don't believe in the mask, that do believe in the mask, and there are doctors and professionals on the same thing. What I am concerned about is the quarantine, because I think we're going to miss more school from quarantine than we are. Say I'm one person and I'm infected. If I have a class with 20, that means maybe 20 kids are going to be quarantined. So that is the issue, is the quarantine too. How are we going to handle the quarantine? And yes, they have the different guidelines for masks is not for masks. We're not going to have these kids in masks all the time. They're not in the mask in the sports. We're seeing the rise in the sports. I've talked to, one thing that really struck me was talking to Boone Pediatrics today. They see many of our Ashe County students. And yes, their numbers have doubled since last week. That scares me as an educator.
The sad thing is only 42% of the people in Ashe County have been vaccinated. That's not herd immunity. Our children are going home to these families that are not vaccinated. And most of the vaccinations in this county are people 65 or over who do not work in the school system. COVID is rising. Delta is rising. If we don't stop this, the next one is going to be even more deadly, because Delta will mutate just as COVID-19 is mutated. So I'm not a doctor. We had 4 people who were very intelligent, who knew what they were talking about, told us the risk of not going with masks.
Now, I'm sure there are parents out there, I know they want their children to go to school without masks. I don't see the possibility of it, and I think we need to decide that. Of course, I've already made my vote plain and clear. I don't even need to vote again. And I have not, I guess, I'm opening myself up for a lot of parents to give me a lot of calls, but all the emails I've gotten, all the personal conversations I've had, even letters in the mail have told me we need to have our children to wear masks. So it's something that we're going to, I mean, we can beat a dead horse to death, but it's something we're going to have to deal with. I mean, if we don't deal with it, what are we going to do? If a teacher has COVID and exposes a class of 20 kids, you're going to send all 20 kids and teacher home and close down that classroom? Is that what you're going to do?
That's what we're trying to find out.
That's possible. Isn't it?
Anything's possible.
I guess. I shouldn't have had a hard day. But I mean, it's very serious.
We don't argue the fact that it's not serious.
I know. I mean, it's very serious, but I mean, to me, it should be simple. We should say A, B, C. What is the purpose of this meeting? Number one, to decide on masks. We're either going to go optional or mask. And then we decide on the other things. Are we going to follow the CDC guidelines, North Carolina guidelines, or are we going to make our own guidelines? It should be that simple. Shouldn't it?
I can't, well, this is me. I'm not speaking for anybody else. I need this before I can make a decision on masks.
Okay, that's good.
Reason being, a lot of this, to me, this is Josh, is forcing us to change a decision that the board had set. And that we are being forced under the regulations, under the quarantine regulations, to change our decision. We're pressured from the governor's office. We're being pressured from the local health department to do that. And then these regulations also are making it to where we will have more students out, and the loss of in-person learning is, to me, more detrimental than them being out with the virus as far as education, as far as learning, in my opinion.
Perhaps if everybody has masks on, we wouldn't have that problem. And different school systems across the state of North Carolina have revised their decision from optional to mask, Watauga being one.
It's
White
still about
County
half
had
and half, Lolly. As of yesterday, it's about half and half across the state. I think it's 55 to 52.
Well, I mean, I'm just telling you other counties that have changed their decisions.
Some of them have, and some of them have because they have the numbers of students that have been identified outside of school.
So-
And I've also talked with educators across the state who are in year-round schools. And their rates started going up before the mask mandate had a choice. They were masked at the first part of the school, and then the second part of this month, they were not having to do the mask. And in those school systems, the numbers are rising.
Absolutely.
But they're rising with the ones that have masks as well. So the numbers are rising, period.
The bottom line is this: COVID is more prevalent in Ashe County today, as we start school back Monday, than it was last year when we started school in August on the B schedule, where the kids went, the B students went Monday and Tuesday, Wednesday we cleaned, and the other half of the class came in on Thursday and Friday. That's the bottom line.
Well, as of last week, Polly, and I'm not arguing with you, I'm just giving
That's
the
a fact.
information I have.
That's a fact.
As of last week, we had 3 students in Ashe County who had been identified as having COVID positive. And that's not what I was hearing through the community. There is a disreport there of what's going on in the community and what the health department has, and I'm not sure what that is. I think a lot of people are doing home testing instead of going through the health department or the doctor's office. I'm not sure where the disconnect is. I know a lot of people have told me that that's how they were had COVID, was through the home testing. So we may not know how many people actually have COVID, and we may not know how many students might come to school with COVID. I want parents to have that choice, But at the same time, guys, it scares me to death that the choice is, I don't know what choice we're gonna make that's gonna be a good one. I should have the right as an individual and as a parent to wear my mask or not to wear my mask, especially for those of us that were promised if we had our vaccinations, we wouldn't have to wear a mask. And a lot of people are looking at it like that. I'm hoping that our students will decide to get vaccinated. We have a number of those who cannot. So we've got a lot of different things. It's not cut and dried, Polly. I wished it were. And I have heard from both sides, numerous people from both sides, educated people from both sides, people I respect from both sides. And as far as what the governor thinks, if he shouldn't have let it get out of his jurisdiction if he wanted to have a say-so in what happened in our school. I'm sorry. I am mad at him because he put it off on us and then tries to get us to do what he wants us to do. So I'm a little bit upset with him over that. So it is a multifaceted issue. It is not an easy issue. And I wish, well, I have not slept a single night completely because I am worried about what is going to happen. And I've had people cry on me about their grandchildren that have been identified. I've had people express their concern about their child who's afraid to go to school because he has to put on a mask, and that's a scary thing. It affects them emotionally, and it affects everybody. You can look at Ashe County and how we treat each other and how it's affected us. There's people who have attacked me personally that I never thought would, simply because I was trying to do the best job I knew how. So we've got to come together with this and support it, whatever it is. But it is not an easy decision. It is not cut and dried. And I don't think anything about COVID is cut and dried. And whatever decision we make again tonight, I would hope that we would look at that decision. And I think some of the rest of you agree that we will look at that decision often. It's not going to be a one-step deal, that we're going to be looking at numbers. We're going to be looking at kids. We're going to see about the quarantines, that we're going to keep an eye on this. And then if we see that masks are not working or masks do work or whatever, that we're going to try to make the best decision for our students. It's not going to be a one-time shot as far as I'm concerned, as long as we've got a virus that is unpredictable. And that's what we have right now. If in July, we wouldn't have had to make this decision. We would have started school, but things have changed that quickly. And it scares me that they might change quickly again. So.
Well, I can tell you with a sure mind and certainty, they're going to change very quickly with 42% of the population vaccinated. That's a fact. And if the parents aren't vaccinated, then the children aren't going to be vaccinated.
Well, we've had several folks vaccinated getting the virus.
As possible. And once this goes on longer and longer, that Delta is much more vicious, much more easily transferred. We have people died with the vaccination, that is 1 out of maybe 1,000 or something. But I don't know. You know, you always hear all these other people at work. If you save one child, it's worth it. So I don't think you can do anything until you decide you're going to go optional or mask. But that's up to you. I mean, I'm in the minority.
I think we have some of the nurses on with Jamie. Is that true, Jamie? That helped to make that really long document down into something, I think, the one pager that you see.
Mhm.
And this changed since before, because when I got the original document, we had to meet yesterday to realign with that whole department.
Dr. Cox, we do have some of them on, but we're having a hard time getting them promoted, but I think they can hear us, and I will be happy to read comments, or if you guys have specific questions, I can try to ask them.
The program is not allowing us to promote them into the meeting.
Okay.
We must have a bad Zoom link.
But they can hear us
They can hear you,
and they can talk back. So
They can't talk back to you.
they can talk.
They can hear you,
Okay.
but we can't get them to the point they can talk back.
Okay, okay. Any questions for the nurses?
And I'll just say that we met with App Healthcare both times. And it's the same group of nurses that work with Watauga County and Allegheny County schools based on, and again, it comes back to what we are allowed to do if we know that not every student will be wearing masks. If the situation were to come up that we had 2 students in a room that were the ones beside each other and they were both wearing masks, then that does create a different situation. But we tried to get this process down to 1 page so that it's very helpful for all of us to have the same information to move forward. There will be exceptions, and every single one of these COVID contact tracing is very in-depth, and we have to get the whole situation and the contact date, and it takes many, many hours. And each one's different, but having this similar guidance should help us.
I've got a question. It was said earlier, some of these do not apply with athletics. So what is the difference in this here and then the athletic portion?
So I guess I need to look at that one a little closer. I thought we had included, but one of the main things there was that if there's been physical contact between a positive and another student, that deems them automatically a close contact. So any physical contact. So anytime you're playing football or basketball and you run into each other or high five each other, the quarantine will be dependent upon whether the close contact is vaccinated or not, or if they have had COVID within the last 90 days. And if that is the case, then if the child has been vaccinated, they are able to test between day 3 and 5 after the exposure. If that were to come back negative, Dr. Cox, remind me where we are on that one.
If they come back to negative, then they return to normal.
Correct.
If they're vaccinated, if they come back negative, they return to normal.
So, Mr. Roten, I guess the other question is if the child is not vaccinated and they are a close contact. The way the CDC states it now is that if you get a test between these days, like day 7 and day 10, that you could come back after day 10 with a negative test result. But you must ensure that the child is not within 6 feet of anyone and remains masked after that. I can't guarantee that, nor can any coach guarantee that in a sport. So it is going to look a little different for an athlete because we can't, in good conscience, be able to guarantee something like that for our students.
What about going back to school? With that
School is
situation?
different. School is different.
But I know of an athlete that was not treated differently about school, was told she could not return to school.
Ms. Eldridge,
Until-
this process was evaluated and changed yesterday. So if that communication happened prior, then they could have had something different communicated.
Well, I think her frustration was that she was told 3 different things by 3 different people. So it's good to have this information. But I've noticed it's very different than what Watauga has adopted as well.
I have not
they-
seen what Watauga is using.
So there's just more additional leeway there, probably because they decided to go mask. There's more leeway there with quarantine than what we have here in some of those situations. So I'd say that's the difference.
These lists that we've had here, the current one that we've got as of today, how long have we been keeping those numbers? Did it just start yesterday or?
No, well, we've asked, but we don't have the kids back, but
Right.
because we are within the time period in which kids would be back, we started keeping them knowing kids would be back and under quarantine. Our nurses were back Monday. As they're reported to us, and again, if they were in school and they were calling off sick, we would have a better idea than when they're not in school. That's not something that parents, not all parents are going to tell us over the summer if their child has COVID or not until they're going to have to miss school. So we don't necessarily get a name of a student unless they're actually with us at that point in time. So we didn't get names of people over the summer unless they were in summer school, unless they were under our care during the summer. So, you know, have we kept the data? Yes, but this is skyrocketed in the last 2 weeks. And from a staff standpoint, you know, we have 7 staff members currently, 3 in the last couple of days. So they're all fairly new. But we didn't have problems with staff being out with COVID over the summer. Now, last year we did, and we reported that to you each week. But we were masked during that time, and we didn't see the, when we saw a change that was going to cause us to have to do a different procedure, such as in January when we went remote for a couple of weeks, you know, we made you aware. If not, we put it at each board meeting where we were for that month. We're at a point now where we're seeing just a continual incline of COVID, and I've asked the nurse. I mean, this changes, like it was changing. I printed this up once since 4 o'clock when you and I talked about this meeting. I printed it up once and had to throw it away because then I got emails with additional positive COVID cases that I had to add to the numbers. So it changes every single day. And then pretty soon, some are going to come on and some are going to come off. So, you know, they're not necessarily the same people each time because it's not a running total. It's who is currently positive and out because of COVID.
Chairman Roden, I'll also add that when the reports started coming to myself and the other school nurses is when our athletics started practicing as a team. Those were our first ones. And within 3 days, we had 3 teams that had several close contacts. So that's when we started. And then we did have just a couple here and there during summer school, but it ended up being not a huge deal in summer school because the students, there were much fewer. They were spaced and wearing masks at that time because that had not been lifted at that point. So the process was a lot easier to go through due to the distancing and our steps after that being in place. But as soon as the sports have started back, that's when they started rolling into us. And then now that we're getting closer, families are testing positive and they're notifying their school that my child's not going to be able to come to school on the first day or the first week because I'm the mom and I'm sick. So.
Well, reason I asked that is we requested information from the health department at the last board meeting. We finally got it Thursday of this week for the end of the week. There, it's dated August 1st through the 7th, showing us only 3 cases, and those are through children age 0 to 18 on there. So, I mean,
and
when you look at this to this, you know, that I don't know how accurate their numbers are to what you've given us this evening.
They are always about a week behind on their reporting. However, Dr. Cox was on the call yesterday. We have 2 contacts that are able to immediately go in and count that for us. It just takes a little bit of notice for them, but their stuff's going through several filters before it gets to that official report that you were given. But at any point in time, we can request a more accurate count.
So, Mr. Roten, the August 1st through the 7th, the updated number was 8. And then as of the 12th, they had 12 for a total of 20. But that was as of Wednesday. And Wednesday, it's gone up since then, but it wouldn't be in any report that you would see online or the situation reports, because those are always, there's some verifiers that they do prior to that. So those situation reports are always a week behind.
Well, this report came straight from
This came
Jennifer
from the
Green.
health department. So this wasn't anything we looked up.
Okay.
And Jamie, I'd like to, I'm not being argumentative with you. I'm struggling to understand and to decide what we need to do to make it better for our kids. It has nothing to do, we appreciate your hard work. I'm trying to understand the differences in what I'm seeing with the CDC and our plan and Watauga's plan. And the numbers are not the same. So I'm trying to understand how we got to that point. So we know what we can rely on and where we need to go with that.
I
So
understand.
I'm not trying to make it no for anybody. I really am not. Just trying to understand.
So we did take on stricter, but just to clarify, we did take on stricter guidelines for our quarantine procedures than what the CDC recommended. Is that accurate? It's okay. I just want to make sure we know that and we know the reasoning. It's just, that's what I'm getting quoted to me. And that's the questions that I'm getting. And I want to be informed and be able to say, yes, that's what we did, or no, or what data that we did use to justify those procedures.
Dr. Cox.
For example, I'm looking at page 17 of the toolkit where it outlines the different days, 7 days of quarantine, 5 days of quarantine. Under what circumstances would there be 7 days or only 5 days of quarantine? And that's something we're not considering, or is that just if you are mask mandate?
So it does change if masks are mandated and everybody's wearing them accurately. Yes, Dr. Simmons. The only area that I'm right off the top of my head looking at is that if they come back to sports, that would have to be for the full amount of time, because we cannot guarantee, distancing in that setting. I will say that based on, it changed back in about, I guess, December, that after however many days they could come back after 10 days with a negative test. But at that point in time, and to my knowledge, it still says that even if you came back after 10 days, that you have to continue to mask and be 6 feet apart. Well, in a Plan A setting, we cannot do that in our schools. Our desks are more than likely 3 feet apart in most situations. So we are, in that respect, being more restrictive just due to the fact that I cannot guarantee that our students are going to be masked and distanced for those additional days. Does that make sense?
Mm-hmm. It makes sense.
But didn't I read in the toolkit that they had changed that to 3 feet, not 6?
Not if you've been a close contact. Not if you've been a close contact.
But in normal situations. Okay.
Correct. Yes, ma'am.
So Jamie, would these procedures change if all students were masked and wearing them correctly?
Mr. McClure, I think that it has the potential to change it if we have a close contact in a classroom and both students are masked. Or if we have both students masked and one of those is vaccinated and one ends up being a close contact. Yes, it would change some of the scenarios. It wouldn't be it wouldn't be everything gets reduced, but it would change certain scenarios. Yes, sir.
Will this also tie into our schools doing the tests at the school? As far as, the tests that they're requiring in the toolkit, are our tests that we're going to be given at the school be credible for this? Or are they going to have to go to the health department and do a different test?
So what we will be able to offer through the testing program that we've opted into is if a student were to come to the health room or a staff member come to the health room not well, that they've started exhibiting symptoms while they're at school, we are able to administer a rapid test at that point. regardless if that rapid test, if it were to come back positive, then we immediately know we need how to contact trace and start, being preventative and getting students sent home. If that test comes back negative, we have the option through this testing to do what is called the PCR test, which is the one that's much more accurate. And we would be able to send that off so that the parent doesn't have to make an appointment, take them to a different doctor's office. The results would be back within 48 hours typically. And even if those tests both come back negative, the child couldn't be at school because something's going on. They're running a fever, they're not well. So it's not COVID, but there's something else going on. They would need an alternative diagnosis. But this should help expedite a couple of things. It should help us identify who is sick and how they are sick fairly quickly. It should help our families be able to get results back. And it should help us on the front end on being very proactive about getting students sent home if they're close contacts, getting them tested as well, that kind of stuff.
So they're going to have two tests either way.
If it's a rapid test and it comes back positive, it's a positive.
Okay.
Yes.
But
If it's a negative, we'll follow up with a PCR. And again, Mr. Roden, this would be all with parent permission. We would have to have consent to do any of that. But we would follow a negative rapid test up with a PCR test to send off, because sometimes the rapid, if they're not very far along in their symptoms, it would not show positive at that point.
But they would go home during that time until that home test, the PCR comes back.
Correct. Yes, sir.
And symptom free.
Well, the last rule on this handout is really where it's going to catch the most people. Sibling, household members symptomatic being tested for student, faculty, staff. Unvaccinated will remain absent until testing of sibling, household member comes back negative. Vaccinated student, faculty, staff can return with proof of vaccination verified and wear a mask until results. But if the test happens to be negative, you can return to school. If the test is positive, you have to follow for close contacts with positive case. So am I hearing this right? If a parent catches COVID, then all the children are quarantined to stay home. They cannot come to school. I've lost a neighbor on both sides and made COVID in the last week.
I'm not sure how we're gonna monitor that,
Monitor.
the parents, whether they're still positive or not.
We are all, we're only as good as people being honest and about their own positive or negative. We hope that parents will continue to keep their kids home if they're sick and communicate with us. And if the parent or somebody that is the primary caregiver of the child is sick, and test for COVID and even get a COVID test, that they don't send their child home because the child is a close contact if they test positive. And so, of course, that's unfortunately how a lot of things quickly get spread. Some people are asymptomatic for a few days and able to spread the disease. And then they're spreading it unknowingly. So we're just asking for that extra caution. If you're sick, stay home, and even things like the sniffles. I had somebody that I know that had the sniffles, and that was it. And then came down 3 days later, was on her back sick because of COVID. And, and it was just normal hay fever allergies is what she got. And, so, this is a really tricky, unfortunately tricky disease that not everybody feels the same way when they have it.
And I'll say, Ms. Eldredge, that we, anytime that App Health is aware of a positive, if it's an adult that through their contact tracing, they do find out if there are students in their home, and that we talk daily back and forth all day, every day. And so if we know that a parent has been tested or comes back positive, then we're in communication. However, you're right. If we have at-home tests, and people aren't keeping their students or, out and, if they're sick or whatever, it's going to cause some issues. We do ask that if anybody in the home has been tested, for them to just kind of hang out until we have results, because we just don't want to be spreading it without knowing it. And that was our procedure as well last year.
Yeah, I think I've seen some evidence where that the numbers probably are rising because of home kits that the health department may not be aware of. That we hear of cases here and there that they had COVID, but they weren't sick enough to go to the doctor, but they did a home test. And so that's great. If you don't spread it to somebody, it makes them very, very sick. So the home test has not helped the control of this at all, probably. But I get it. Go pay $20 and you do it on your own. That has a certain appeal as well. The other question I had was, are we adopting there were certain things that the plan from the CDC said that we no longer had to be worried about at the end. And one of those was volunteers in our school, if they followed the protocols. We have field trips as part of that. There are several of those things that were no longer recommended. Are we going to implement those as the CDC plan states, or do we have other things? Because it says 1 day cleaning, it said once a day cleaning, and it doesn't mention Wednesday cleanings.
We're not doing any of that. We're going to go to school 5 days a week, full time. The cleaning will be normal, thorough cleaning that our custodians do on a normal basis. We still have, we do have some volunteers that can come into our schools. Obviously, we still have to be careful with that, especially and watch it as community spread is increasing. We still have things going on, field trips, within the county, going down to the local creek to take a water sample and do a science activity. All students have to wear masks if they're riding on a bus. You still have to get your parent permission slips like you normally would for any other field trip. But those things can continue as long as our toolkit says that they are not, as long as they don't ban them in the toolkit.
Well, I know at the middle school last year, and then I'll hush, but the middle school last year, we kept the kids in one room and rotated the teachers. I hope that's not the case this year.
No, they are, I don't know what their schedule looks like exactly, but we discussed that it can be more open than that. We can have some flexible grouping, but they do have to have seating charts, because if somebody comes down with COVID, you have to know exactly who they were sitting with. And same way with small groups. So we had a discussion about station rotation. You have to know who is in that station with that child during each of those rotations. That's why it's nice to simplify it. We want to get back to as normal as we can. But that's why we're not sending everybody free for all into the cafeteria, because we would have to have assigned seats to be able to contact trace. And if not, you'll be shut down, spread to the masses and maybe not even know it.
So we'll be back in the rooms for lunch.
We are at this point in time. But that way, we know who that they are with. If you just send them all into the cafeteria, we'd have to assign those seats, and then you have chances of them eating even closer together in the cafeteria than they would in their own classroom. And that seems to be the time that kids are most vulnerable, is during lunch, because they are unmasked. So if you have 100 of them unmasked in a cafeteria sitting closer together, versus further apart in the classroom and only 15 in the class, provides a different level of protection scenario for our kids.
But we're just 3 feet apart now versus,
It depends on the classroom.
okay, but we're not at 6.
It depends on the classroom. Some are not.
I know our little grades are going back to tables versus desks.
Some of them are.
We heard from a teacher.
Yeah, some of them are because we know how kids learn best, and that's the hard part in here. We know best practice for kids. We want them to work in group work. We don't want them to sitting forward in straight rows. We would love for them to be able to get back to some normalcy. But looking through the guidelines, should and shall are, very, the semantics in here. We're just trying to keep kids safe too. And I want them to be in school, not quarantined. We want them to be learning together and not having to do individual work where they're facing forward and feel like they're robotic. We don't want that for our kids. So we're going to be we're going to have as many things that we can do for children and learning and to have a normal experience as possible. But there are some things that we do have to do. We have to be able to say that Johnny was sitting next to Sally and had their mask on for 20 minutes.
If a decision is made to reverse a decision, is there going to be any options for parents that thought we would have somewhat of a normal year to pull their child to Ash Online? I've gotten questions about that, just asked.
Our Ash Online is full right now. We would have to take teachers that are currently in the classroom and make them teach online. That's the only way to do it at this point in time. So the only ones that we currently, that I'm aware of, that are Ash Online, were on Ash Online last year, and or who have a medical exception or some reason why they were maybe a more vulnerable population, and or maybe they were. We have one that had a family member who had been on a ventilator this summer. Those exceptions, we already made, and we have accommodated as best as we can. But at this point in time, we literally have to move classrooms around because we don't have another teacher prepared to do that at this point in time.
Any other questions?
There's just one thing that jumps out at me, and it does come from Watauga, and it's that it states that student and or employees who have been identified as a close contact will be required to quarantine for a minimum of 14 days unless, and one of the unless is close contact, the person, has been fully vaccinated and is asymptomatic. That does not apply to us. I just want clarification. That does not apply to us. Right?
Jamie, are you back on there?
Yeah, Dr. Simmons, yes, it is recommended. It is not required, but it is recommended that if you know you are a close contact, that if you are going to have the virus transmitted to you, that if you are tested between day 3 and 5, if you're going to have it, that's when the symptoms would start. So all we are asking is that if you know you're a close contact to someone, vaccinated or not, and close contact means within 6 feet for 15 minutes or longer, that once you have that negative result after the 3 to 5 days, you're able to come back. We just would hate for someone to be there spreading it and us not know that. So we still feel like that is a precaution that we feel like we can make at this time.
Okay.
You are correct. That is a difference, I guess.
So I guess when I hear, that we're not being protective, we're not, because we're giving a lot of choice, we're giving the choice with the mask, there are things that we are doing to be very protective because like this states, the recommendation from the CDD is that if close contact has been fully vaccinated and is asymptomatic, that there would be no quarantine, but we do have a procedure in place where we are being extra cautious, right? That's what our procedures that we put out on August 12th, that's what they say. We are taking extra precautions.
Yes, ma'am.
Okay, right, yeah. Is that what you all understand?
It's more strict.
Yes.
I thought the CDC, maybe I'm just repeating what you said, Kim, I don't know, but the CDC's recommendation on July the 9th was that all schools should require all students, all staffs, K through 8, to wear masks. 9 through 12, unvaccinated wear masks consistently when indoors. That's the recommendation from the CDC on July the 9th. And since then, COVID has gotten much worse.
So does that mean if I'm vaccinated, I'm at the high school, I don't have to wear a mask?
It says that that's their recommendation, unvaccinated wear masks consistently. No, but the thing about it is, this thing is growing so fast and spreading so quickly that they come back and they change because they have to, because people have not gotten the vaccination.
The other part of that is that somebody's going to have to monitor who's vaccinated and who's not. I don't know how you do that in the hallway. If you see some kid without a mask and you go, oh, you must be vaccinated, or are you vaccinated? You can't answer that question. And it's impossible to monitor. So,
It's either an all or nothing when it comes to that, because I don't want somebody wearing a label, whether or not they have a vac.
I don't think you can legally even do that, can you?
Yeah. We may get where we have to have it tattooed on our foreheads. I'm not sure.
And so one of the things that, if they are both masked, we could put at the end of this, we just didn't because masking was optional and we were trying to simplify, but if they are both masked, both students, and they were vaccinated or not, if they're the 6 feet apart, they do not have to quarantine if that's the case. But again, we don't have that on here because masking was not our policy. And again, just like vaccinated or not, whether somebody had on a mask or not, for our teachers to guarantee that would be another, task that we've asked them to do. And I think that'd be very difficult.
I knew that sometimes during the summer when there weren't children present, the adults in the building did not wear masks. Would that still be an option if we do go to requirement of masks? Would that still be an option for those adults?
That's up to the board as far as that's concerned. The recommendations here, are that they wear it, but we, over the summer and other times, if you're in your room, you're not around other people, you take it off. Jamie's sitting in her office by herself, she doesn't have a mask on.
I was thinking in particular how hot those kitchens get, and some of the cafeteria staff where there's no children there or not allowed there, and they've all been vaccinated. It just, it's easier to mandate an all mask thing, but it's not always practical for some areas.
Well, and I think student staff, there can be differences. There are that CDC, as far as what they're saying, what they're recommending, just depends on how you're going to. We can say that it's by themselves or in their room, or when children aren't present, we can put all those caveats in there. That's up to you. Or, it can remain how it is currently, where there's choice. If we had, convocation, we put them 6 feet, marked off 6 feet apart. Not everybody chose to do that. Masks were optional. We had a lot of people that wore them and some that did not. We didn't ask if they were vaccinated or not, but we had a good portion of people that did. But again, that was their choice. And, most people were okay with it because they're adults in that setting making that decision.
I'm a little worried about athletics and how they're going to affect these numbers. Because you work with a football team or something like that, you're talking about several students that could be out
Yeah.
under quarantine if they're operating under a different procedure than these. I mean, is there a certain point that we're going to have to get to if this thing ramps up that we don't play ball? I mean,
I don't want to get there because I think athletics are really important for kids to stay at school, for their mental health. But there are some things that we can do. So for example, we have, 4 kids that are on, a JV football team that are now quarantined, will be due to close contact with somebody on a different team from a scrimmage. Those things are going to continue to happen. But as far as the length of time for quarantine, there's a difference between the length of time a quarantine from playing football versus the length of time that they can actually be in school. So we can't, if they're playing football, they're close contacts, they're hitting each other, they're tackling, they're playing. So we can't guarantee that they're 6 feet from everybody. So the time that they will be off the field would be longer than the time that they would actually be out of the classroom. Correct, Jamie?
Yes, Chairman, and that's correct. The only difference is after a negative test result, the ability for them to come back to football versus coming back to school. Because they can't play football without touching each other. So they would still, it's 4 additional days. And the reason for that is that there is still a percentage of a chance that they could, start showing symptoms between day 10 and day 14. So that's the only difference. All the other, the way that it's, the contact tracing and all of the ways that you could be a close contact are all the same. It's just versus the time out of the classroom being less than being off the field.
well, I had a parent call me, and I know it was kind of mentioned earlier. They play volleyball, went to a camp August 3rd, or 29th, July 29th, was back with the individual. The third was considered a close contact. The other person was positive there. So under what you're saying, what was updated today, will they be able to start school on Monday? Because their 14 days will be out the second or third day after school starts. But if this is changed, they tested negative 3 times, then would that 10-day rule apply?
It will depend on if that child is vaccinated or not. So I have to look at each case a little differently, and I kind of know what you're talking about. But even if the child is not vaccinated, if they are a close contact, if they are unvaccinated, they will need to be out for 14 days. Is what it says underneath close contacts on the protocol you have in front of you. And return on day 15, as long as they're asymptomatic.
Okay, well, now I'm confused. So it's 14 days, they can't go back and play ball. But now I thought it was different to return to the
10
classroom.
days to return to the classroom.
With a negative test. That can be
Right.
discussed. We would have to, Dr. Cox, if I'm right, we would still have to guarantee the child would be masked and distanced in the school.
Distance is, well, I'm confused again, because I know it was distance playing ball, but now we haven't said anything about 6 feet in the school.
Mhm.
You're supposed to be 6 feet distance between that time period. If you
For the 10
compare
to 14 days.
for this days 10 to 14. So in the classroom, if our classrooms are spread, that's why it's so confusing. I mean, there are so many different rules here. I mean, you guys can look down through them and they've changed a few times on us. So trying to consolidate it to make it, to keep kids in school and so that we can prevent spread as much as we can. And hopefully kids are not missing too much school. I wish everybody was able to get vaccinated at this point in time. And that would help a lot. I mean, you get vaccinated and some of these things just don't apply. You're back right away. Wearing a mask helps. But even without the mask, vaccinated helps too. I want kids to be in school, but when you're unvaccinated and you've been a close contact, there is still that chance of spread during that time period. And of course, they have to be symptomatic. If they're negative though, they test on that day 3 to 5, correct?
So
No,
that's only if they're vaccinated. So if you look on page 17 at the bottom, where it just says exposure. So a person who is not fully vaccinated and has been in close contact with someone with a confirmed case of COVID-19. So if you look over on the right side, the person can return to school after completing up to 14 days of quarantine. The 14 days of quarantine begin after the last known close contact with COVID-19 positive individual. Alternatively, the person may complete a 10-day quarantine if the person is not presenting symptoms of COVID after daily at-home monitoring, or they complete 7 days of quarantine and they report no symptoms during the daily at-home monitoring, and the individual has received results of a negative antigen, and we are saying PCR, because that's the most accurate test, and it was taken no earlier than the 5th day of quarantine. And then if you'll look down there, if in bold print, if the quarantine is discontinued before day 14, the individual should continue to monitor symptoms and strictly adhere to all non-pharmaceutical interventions. Examples, wearing a mask and practicing social distance through the 14 days. So I'm completely not opposed for that child to come back after day 10 to the classroom, but there would be some provisions that have to take place. That is not written in our current procedure that you have in front of you.
If you're in a class of 28 kids, it's going to be hard to keep them 6 feet social distance and ensure that they have a mask at all times during the school day. And that's why we're just trying to be safe. That's all.
Well, I mean,
Only 2 ways to be safe. Everybody in Ashe County needs to line up and get vaccinated. And we need to wear masks to school. And maybe by January, we go back unmasked and we'll fine. People are going to have to get vaccinated. Some way we're going to stop this thing. It doesn't hurt. It's a little pain and you're finished.
So Chairman Roden, when we discussed this with App Health, I do remember this part of the conversation. Other districts have toyed with the idea of letting people come back after day 10. And what they have found is that it is incredibly difficult to monitor a child at all times without making that child feel ostracized or separated from the group, kind of singling them out. And so that discussion went around for a while. And I think that's where we decided and came up with the 14 days.
I think it would be different if it were like they've been in school 2 weeks than the first day of school. I think that's hard on some kids to miss that first day and miss all those classes and all the information and have to get caught up. I mean, if it were 3 weeks from now, I think it would be as detrimental to do 14 days as it would to miss the first 2 days of school for some children.
We, on a call with principals and directors just today, I asked that all of them, if they have somebody out that's quarantined or positive with COVID, to have their teacher contact them regularly and make sure that they feel part of the class. So that should be happening starting on, probably as early as this weekend. If someone like to get their contacts in before the first day of school. It's not ideal for somebody to miss the first day of school. Like I said, we have 9 kindergartens, so we're going to miss the first week of school. And that's incredibly difficult. I mean, it just is. It breaks my heart to think about that. But I know our teachers are good. They will make sure that they feel part of the class and are not behind because they missed that time.
I think sometimes it's more difficult for adolescents than it is for our kindergartners.
I think
They're just be conscious of being different.
Mr. Chairman, one thing I'd like to say, since our last meeting, the thing that strikes me the most is that we have a lot more students who are COVID positive. That concerns me. At the last meeting, I didn't get, maybe I didn't hear the numbers or I didn't get the numbers. And, that played a lot into my decision for optional mask wearing. I dislike mask. I think it's uncomfortable, but that's not the big reason. The big reason is that it should be, we should have this under control and it should be a choice. But at the same time, maybe we need to take a step back, look at seeing if our numbers go down and having students wear masks require that, even though that's I want those gone. Maybe we need to take a step back and look. And hopefully, if this thing turns around, we can keep these positive tests out of our school system. I don't want students to have to miss days. It bothers me that they miss days. It bothers me even more that they might be sick.
But younger children are now getting it, and younger children are now dying from it at a higher percentage than ever before.
I'm just gonna throw out a question that I've wrangled in my mind for weeks. If this board has to make a decision on mask optional or mask required, because the governor's office thrown it in our lap, then why do we need to follow a toolkit that's not, I mean, if you give us options there, why don't we have options here? That's just, I mean, that's bugged. Just putting it out.
We can go either way. Mask or optional mask.
Right, but I'm saying, even if we're optional, we're still having these guidelines. We're still having kids that's gonna be out 14 days if they don't wear masks. If they do wear masks, then they get to come right back to school. So we're being forced, in my opinion,
Well,
to
that's
make them wear
following the science
masks.
study. That's scientific facts.
I'm
That's
with
it, the mask, yeah.
So Chairman Roden, the health department is the only one that can issue quarantines. We provide a lot of the contact tracing that goes on to determine whether or not a child was a close contact in class lists, who they were sitting next to, lots of information. We can go as unrestricted as you want here, but knowing that there is a risk, according to what's written here. And of course, I only know what we've been doing and what is actually here. You know, I don't know what that percentage of risk is. I don't know if any of us really know that information. I just want to keep kids safe and in school. I mean, I hope to never have to shut down for 2 weeks like we did in January. I don't want to ever have to do that again. And, you know, I want kids to be in school as much as possible. So, and be realistic about what our teachers can and cannot keep track of while in school too. So, you know, I don't want kids to be labeled for vaccination status or whether or not they have a mask on. I don't want us to impose that on them at all. But if you want to, you know, change this, the one, you know, I don't know, some of these we have to follow because they come from the health department. You know, if you want us to go less strict, so having kids come back, we just knowing that we can't guarantee social distancing or that they've worn a mask, you know, monitor that would be tough to ask. But we can do that if that's the.
It just frustrates me that we have to make this decision, but yet there are guidelines that are forcing us to go by. To me, that we shouldn't be sitting here having to do this.
I agree.
That's just what is the most aggravating thing, and it's kept me up since we met at the first of the month.
We have been in an impossible situation, and it's really unfair to each of you because all 5 of you deeply care about children and want their safety and well-being to be at the forefront. And I know that, and I know everybody on my staff, mask or no mask, believes the exact same thing. We all believe that. And we all want that for kids. So we are absolutely in a very impossible situation. So thank you guys for sitting here and taking the time again to go down through this on a Friday night because it's very difficult.
Do our schools need more time? I mean, they didn't get to hand out Chromebooks. Some of them didn't get to have open house due to the storm. You know, I'm just saying. I mean, is there an option that would it be beneficial if the schools had another week before we start school? I don't know. I'm asking for them to go back and be able to drive through and pick up Chromebooks, because I know most of them were outside.
Well, I hope that on day one, we're not really using all our Chromebooks. I mean, we'll be using them throughout. It's a great communication tool, but we really want kids reading books and interacting with people and getting to know their teachers. And that doesn't always happen through a Chromebook. You know, we have assignments outside of the Chromebook. Now, would it be helpful for people who are quarantined? Yes, some of them already have their Chromebooks. We had a huge deployment over the last several weeks at the high school, for example. You know, we do have some families that have devices on their own so that they can access some of the materials. So, you know, I would hate to think we're so dependent on it that we can't function.
Well, I'm not using that as the only example. I'm just
Yeah,
overall.
I get it. You know, I'd like to start school. I think we can start school even with that happening, but I do think that, you know, we're going to be, and I haven't had a chance to talk to principals about that option. They're the ones who do the day-to-day operations, and then we'd have to rework the calendar as well. You know, we could do an option, you know, make a work day from somewhere else in the calendar and pull it to Monday if we had to.
And I'm not saying that's what we
Right.
need to do. I'm just
Right.
saying, I mean, there seems, I don't know. It was hard for me to get the protocols yesterday. And then knowing that we're starting school on Monday. Just, you know. For me, it would have been nice if we knew about them when we made our original decision, to know that. But and that's why I'm asking, would that give more time to have those more implemented in place? I didn't mean, I just used Chromebooks as an example. I wasn't using it all, but they needed to give out the the Chromebooks.
So you mean the COVID-19, the quarantine procedures, is that what you're talking about? You know,
Because I'm not,
it's in the
that
toolkit,
is, I mean,
right, and it's changed now twice since it came out.
I think I have,
Right.
several versions at home.
And, some of them are, language from masks or new masks because of, because of the grade spans that are available to get the vaccine. And that's what initially changed. And then, of course, they've had more language changes, some of it shall and should, that are, to me, pretty much the same thing when you're having different people make different decisions across the entire state. That's it. It makes everybody question, what these procedures really are. I get that. But to make it concise, our nurses came back on Monday like everybody else, and they're really the experts. And so they meet weekly with the health department. And so we've tried to make that huge toolkit into something that is understandable here. And that's what that one pager was. I think they initially had sat down together on the 10th and put a document out. Anyway, and it was a lot more strict than what this one is. And that was, of course, the wishes of the nurses, who we rely on to execute a lot of this stuff. We came up with a different scenario that could be a little bit more relaxed and added, based on the toolkit and the health department's recommendations yesterday. And that's what you all received yesterday.
I don't have anything. Anybody have any other questions? I'll have more later. I don't right now.
I sort of like that idea of maybe giving a couple of extra days to get prepped for the quarantine kids and for Chromebooks or whatever, but you're right. I'm hoping we'll minimize the use of those Chromebooks, except in the cases where they have to send stuff home.
Well,
And if we're having issues about not going into the houses because they could be COVID in that household, then the Chromebooks is an easy fix for that. We used it a lot last year, so we have some expertise there that I wish we didn't have, but we do. So that's not a bad 56 students, and who knows how many there'll be by Monday. You said how many you
we have
getting
like
called?
56 quarantine plus 17 positive, so that's 75, right? 73.
73.
Yeah, 73 students currently. I think teachers are prepared to start on Monday, and we will. We know who those students are, unless they came through this evening. But our nurses know who they are, so those provisions will have to be made for a few additional students at different grade levels. Like I said, I'd like to get started on Monday, and just work to make sure we're accommodating kids. I don't know how many of those quarantines will be up on Monday and how many will be up 2 weeks from now or 10 days from now. That's not in that particular number. That's just as of today, how many are out quarantined or positive could be quarantined too.
It's just like a revolving door.
And it'll continue. We'll get some on Saturday and Sunday that absolutely won't be prepared for, but that will always be the case. It'll be a continual cycle, unfortunately, until we get rid of this thing.
Sad for teachers, that's hard.
So, and it is. I know that we do have, all of our teachers have Zoom. They all have Remind. We do have, outside of their Chromebooks, of course, we do have, they all have either Canvas or Seesaw, and the teachers have set up their pages. So, the access should be there, but, parents may need their Power School number, things like that. But we do those things at the beginning of the year, every year anyway, regardless of whether they're in school or if they were homesick for a different reason. We're still going to have to give every child their number. We just have to think of a different way to provide them their access.
So looking back at January, we had 77 students either on quarantine or a positive case. Had 31 at the end of January, 18 in February, and then went back up to 48 in May from last year. So January was our worst month last year, looks like, one of them. So we're a little less than January.
I don't know that we have this many positive cases in children in January, though. I think we have more positive cases currently in children. Not as many quarantined.
I actually had 17,
17.
same
okay.
number, same number. 17 quarantine. Yeah. I mean, positive cases. It didn't break down the quarantine.
Well, I go back to what they told me at Boone Peace this morning, that their cases are doubling weekly. So if that's the trend of all of these cases, that's very scary for families and for us, if it's doubling. And that's not somewhere downstate. That's not somewhere away from here. It's a doctor that many of our students go to.
Anything else?
Keith, you're too quiet. Can we hear from you again?
I've been listening, but I'm like Mr. Roten. I think our hands are tied. I think that the state is forcing us to make a decision on this.
Anybody have any suggestions, thoughts, motions?
I looked at this message that came in right then because I was curious why she would be messaging me now. I just heard from a parent who said putting school off a week would help the quarantine kids because it gives them another week to get over the quarantine. And here I go mixing it up again. I wish we knew how many kids would come out of quarantine in a week.
I do too, but I'm just afraid that we'd have that many more go into quarantine though.
I'm afraid of too, with what's going on in the community.
Diane, the other thing is it does change. So we'd be testing in January, which is our high winter months. We'd have to push everything differently throughout the entire school year to make that week work. So, I mean, there will be, it's more than just changing, a week with the calendar. We'd have to sit down and make sure that we are
That
reviewed
doesn't,
all different parts.
that doesn't concern me as much as what, are we gonna be in school come that January? The way we're going, we may not be in school. So, I mean, if that's in the best interest, then we might need to do that. But I think Mr. McClure is correct. I feel for those parents who have children who are positive at this time, but I think we're gonna have a lot more. Holly, I think you're right on that. I think it's going, looking at what's happening statewide and nationally, has changed my thinking a whole lot about this whole process. So.
We have some quiet moments around here every now and then.
It's heavy. I mean, it really is.
So maybe we could clarify just what has changed since we took our last vote? I mean, exactly what has changed. I know for me, I've realized a few things in that I want to make sure, since parents have the decision, that they understand the benefit to their decision to put a mask on their children. Even though it may not be comfortable, it may not be what they want to do, it's their decision and to put a mask on their child, what that benefit may be. But I'm not seeing that in our procedures, that there is a benefit. That's one thing that I've identified. Other than that, I would like to hear what you all have identified as changes. I know we've seen some increase in numbers, and I know that it's happening fast. And something I definitely want to keep an eye on. And I have been asked, for more transparency, more clarification. What are you basing your decision on? And I want to be transparent about that. And I want us moving forward to be more transparent. If we're going to start changing decisions, let's start being transparent about the data that we're using to change our decision. So if nothing else, I'm not wanting to prolong, but I would like to be transparent in what that is. If we're looking to change a decision or looking for a motion, because otherwise we have a plan and we have procedures. I agree with you. I would have liked for those to have walked hand in hand. The plan and the procedures, they did not, but I understand we don't live in a perfect world and timing's not, can't be worked out all the time, but whatever data that we're using and whatever data we're bringing to the table to make any changes, I'd like for that to be transparent to those listening and to each other. Well, I think I'm with you, Kim. When last time, I know I was the one that made the motion. I was very conflicted, but what's really hitting home to me right now is our numbers are so much greater than they were just 2 weeks ago. And frankly, I'd hope the governor, if it, what I guess was in the back of my mind, if it was that serious, why didn't the governor step in and do his thing instead of leaving it up to us? And I thought that he would. And I thought he would. And I honestly thought it was going to get that bad that he had done it before and he would do it again. Well, he did not, and he's putting it in our laps again. And but let me throw this out there. Someone has suggested that in a conversation I've been having, that maybe we look at high school kids who have the option of being vaccinated differently from our K-8 or K whatever that do not have the option to be vaccinated. Is that a safety thing that we might look at? Muddies the waters again, but that's sort of what was suggested in the guidelines anyway, and the toolkit that we let the high school kids go have mask option, and the other kids do not have mask option because they do not have the option of the vaccine. But that may be muddying the waters again. A lot of parents are worried about their kids with the mask, but you know what? The kids have handled it a whole lot better than I do. I hate them with
We had a
passion.
problem with the children last year with their masks, and they might pass out, they might get sick.
We've had some cases where there were some anxieties and some
Oh,
different
sure.
things and speech issues that it was not,
Headaches.
yeah, it was
My little
not,
3-year-olds.
it was not mask free, but the younger kids just accept it more, I think, than even us as adults do, that we have to wear that mask. I'm not looking forward to that again. I don't know, but I know it's getting late.
To answer your question, Dr. Simmons, changes for me are we have some numbers to look at that we didn't have when we made our previous decision. We've got quarantines possible that we didn't know how many we were going to have. And now we have procedures presented to go by that, let us know. Those to me are the biggest. Everything else has been the back and forth with this virus the whole time. You hear one side here, then the other side says something opposite, and it's just been the back and forth playing tennis this whole time. And, whether vaccine or not, vaccine people are getting it, unvaccinated people are getting it. One gets sick, one don't, one does, one don't. And it doesn't matter on there. That's a changer, plus the misinformation we're getting. 1 minute we're told one thing and we're turned around and we have to pivot and completely redo again. That's the most aggravating, and I know it is for our staff. I think transparency is important. Ms. Walker, I appreciate you being able to put this meeting on short notice for our parents so we can be transparent in presenting this information, because this is very important to them. So thank you for coming in and to do that. Dr. Cox working this out for us to be able to do this, because parents are concerned about it. We're concerned about it, or we wouldn't be here. So I'm still conflicted. I don't know that I am any better or any worse than what I was before.
Well, the facts are 97% of the new cases are unvaccinated. 97% of the new cases of COVID across the United States, North Carolina, are unvaccinated. That's a fact. 99.5% of the deaths are unvaccinated. 99.5.
But we still have vaccinated dying.
Well, I know, but the chances are
Slimmer, but it's still happening.
you'll never.
I can't do anything about people being vaccinated or not, though. The only thing I can do is make a decision about the mask.
Mhm.
And ultimately, the decision that we make has to be directed at what's best for students and what's best for our staff. That's our business. So I want us to make that decision, make a decision or not make the decision, but to stay in our lane.
Coming over here tonight, I was thinking about, I know some of you know I had a bad car accident, and I was thinking about this mask, and the analogy came to my mind is a seat belt. Put on your seat belt every day, and you have to wear that seat belt. But when you are in an accident, you're sure glad you got it on, because it saves lives. So I don't know if that's pertinent here or not, but I was thinking, I don't want anybody to get COVID. A mask would prevent that, as the way our numbers are going up. If I thought we didn't have to have them, I'm with Kim. We need to just make this mask or not mask, and then go with the procedures that are least restrictive to quarantine that we can. Because if, we've got to have those kids in school, and having strict quarantine rules is just as bad as them getting COVID. As far as that goes, as far as school is concerned, I'm not saying health-wise, I'm saying school. I did not sign on here to be a medical advisor to anyone. I just signed on to try to do the best we could for students.
I think the key is we have to do what is best for all the students totally, not what this little group wants, or this little group wants, or this little group wants. And that doesn't make me popular. I know. But we have to do what is best for all of the students and staff. And I think maybe that's what you were alluding to, Kim. So,
Dr. Simmons, what has changed my thinking also is that increased number. I've looked at the report from App Health Daily, and it just keeps increasing. And also, I'm reading and hearing of more young children being hospitalized with COVID. That concerns me quite a bit. I dislike masks, as I said. I want us to be without them, but my thinking has changed because of hearing this information and seeing these numbers increase.
Mr. Roden, you mentioned transparency. One of the things that we are working on, it's not ready to go live yet, but we have a dashboard that will be on our website that will have actually a page that has all the COVID information on it, but it also will have a dashboard on it that will get updated weekly with where we are with quarantines and positive cases, staff and students that we'll have online. Anyway, we're working on the technology part of that, as you know, we don't have anybody that really is dedicated in our district specifically for that. But we're working on that now and hope to have that ready next week. And that way families, know where we are more regularly than once a month at a board meeting or whenever, however often.
I think the group putting these numbers together, I mean, they're very detailed. They give us a lot of information on those numbers.
And that was thanks to our nurses.
And that, yeah,
It's been an awesome.
excellent job.
Mhm.
I know I've heard from some parents that they're more on top of things than some of the parents' calls they get from the health department. And,
Absolutely, and I've heard the exact same thing, but if we just, and this is timing, I know getting school started back, but our teachers are they familiar with these procedures?
Some of them are.
So our nurses are the ones and our principals are the ones who are actually providing this information to families, not our teachers.
Okay.
So those are the ones who are doing that on a regular basis. So they're the ones who are in on those conversations
Okay.
and who have them, yes. Yeah, as much as we can remove from our teachers, they day in and day out, they have so many other things that they're dealing with. And so we see this as more of an administrative task. It's hard enough for our nurses who, have other things that they deal with on a regular basis as well. COVID is absolutely on top of that. It's not anything that any of us imagined, 2 years ago that we'd be doing. I'd rather be talking about teaching and learning.
I wasn't gonna say nothing about it. I'm a little worried about the cleaning. I think that was a big factor last year. I mean, a huge factor on there for it to change in the toolkit. Does worry me a little bit. Personally, I think the cleaning of things is a little more important than the mask, because especially the little ones, they touch anything and their hands go right to their mouths.
Mm-hmm.
And for us to be letting up on that, but then turning around and changing this or adding this or that, that concerns me there, that I wouldn't say letting up on cleaning, but not as strict cleaning. That does bother me a little bit.
So I know that we still have all the hand sanitizing stations. We will be continually instructing children on hand washing, and we still have water fountains that can't be used and things like that. Teachers in their classrooms, there's kids, they do put their hands in their mouths, a lot. They touch their face. I adjust my mask more often than I probably should. you know, they're hard to get used to sometimes. But according to what they're saying here, and that's all we have to go by, is that that was not a high yield practice in the extensive after every touch cleaning that we were doing last year. So, you know, they're still cleaning, and our schools are some of the cleanest schools
Oh, absolutely.
anywhere because our custodial staff is amazing. And, you know, our teachers, you know, take pride in their classrooms. But we're just not having to clean after every single, you know, time a student gets up from their desk, like we were last year.
It may be to that we learn more about the virus and how it was transmitted. That's why the emphasis on the cleaning had shifted some. At least that was my hope. That for sure.
But, you know, if we get a case, we're spraying it down. I mean, we're cleaning extra to make sure that it's gone. I definitely don't want to take the chances with our children.
What was the lady's name from Duke? Tammy, what was her last name? From Duke?
McGann.
McGann. Well, she said with proper masking, vaccination, ventilation, bus safety, we could go to plan A with the mask. She's even suggested when she was here that 2 years, anybody over 2 years, wear a mask. I'm not suggesting that. But she says universal masking, regardless of vaccination status, should be fully implemented. And she's a doctor, she's a pediatrician, because children are getting it, children are in the hospital. The other gentleman who is a pediatric doctor and teaches at Duke and UNC said masking should happen in K-12 until vaccine available to everyone, because we know under 12 cannot be vaccinated. So he said masking K-12 until vaccine available to everyone is vaccinated. The Delta spreads much faster and is more vicious than the COVID-19. And she said that we'd had a 200% increase then in the last 14 days. And I think it's up to like 300% now, maybe more. So, I mean, I think they know what they're talking about. We have the numbers from them and the advice from them. And Jennifer said practically the same thing. When she walked in the door with her mask on, that sent a message to me.
Are we anywhere different? Keith, do you have anything?
Was that to me, Mr. Britton?
I just seen if you had anything else.
No. I just thought Polly was making that in the form of a motion. I didn't know if she was or not.
I was just
didn't hear.
repeating why I voted for masks last time, because the experts said we needed to mask our students K through 12 for safety reasons. That's the only way they can be safe, because children under 12 cannot be vaccinated, and children under 12 are now becoming a large portion of those who are affected by this vicious virus. Children are dying from it.
So Polly, are you putting that in the form of a motion?
No, I'm waiting for somebody else to do the motion.
You know, it's all in how that we look at it, because last time when we voted, it wasn't that I was voting against mask. I was voting for the option of parents to make that decision for mask. I mean, I know we keep putting it in these boxes. I'm all for mask. I want mask, but I want parents to make the decision to put the mask, to put them, to view for their children to wear masks.
Well, but, if a teacher gets COVID and you've got 20 kids in that class, what happens? Those 20 kids go on quarantine?
So quarantine procedures are dependent on close contact. So just because you're in a class with someone does not mean that you would get quarantined. Now, there are some districts who have quarantined an entire class. But if we have procedures in place and know where kids are seated and who they're next to, for 15 minutes or more, then, we don't have to quarantine everyone. But again, it's dependent on, there are multiple scenarios. If you're vaccinated, there are different procedures in here if you're vaccinated. And of course, families would have to disclose that to us and would have to be verified by our health department. And then they have, it's different.
For that to happen, the teacher would have to be standing in front of the classroom and never make any contact with those students at that desk.
So it's 15 minutes or more over a 24-hour period. So if they're walking around the classroom,
It's okay.
then they
Okay.
would be fine. If you spend 10 minutes with someone and that's it, and you're not a close contact, you should be fine. But again, that's a should be.
Should.
All of this should be.
Should be.
I know people who have no idea where they got it.
That's right.
So, it could be anywhere.
One of the churches is quarantined right now. Hardee's is closed down. Because of COVID. So I'm assuming they're telling the truth. I don't know.
We've been sitting here for 2 hours
I know.
right now. I'm going to call a break for 5 minutes. As chair, I can do that. I want to call a break for 5 minutes. We'll come back on here at 15 till.
Make us hope so we can go home and watch the Yankees.
Do you want to do it? You want to do a motion to take a break or do you?
I don't think I have.
You don't have to, good.
I have-
All right, I'm going to mute it.
So we'll take a break for 5 minutes.
Perfect.
Very.
All right. We're back from break. Mr. McClure, are you still with us?
I am.
Okay, thank you. I just wanted to double check, just to make sure.
Okay.
Thank you for hanging with us. All right, we've had over 2 hours of discussion and back and forth. The floor is open for any more discussion or any motions. Is the sound on online? I've got a message that they didn't have sound.
Well, because we were on break.
Okay,
It's a delay.
It's because we were on break.
all right.
They
Yes.
should be hearing now.
I watches.
Yeah.
Dr. Cox, if there was any way that we could get at least 2 days so that our elementary people can have their open house and meet their parents, 2 extra days, is that going to, but the weather forecast, if they planned it outside for next week, is not any better than what it was yesterday, was it?
It's not, it's worse.
Worse because of the storm in Florida.
It's coming this way.
I understand what you're saying, but I do know that if we get started and are able to at least reach a good chunk of our parents during that time, our teachers will make sure that kids have what they need. I just ask they be patient and over, with quarantines, we're not going to hold things against kids and have them get behind
Well, I'm asking,
because they're out.
I'm asking for the teachers more than anything. It's really, hard to have everything geared around that open house and making those decisions. And then all of a sudden you don't have that information or that contact with that parent. And if we're going to do it outside, that next week's not going to work.
Well, Mr. Chairman, we can sit and think about it all night, and that's the reason there's 5 of us. So we each have our own opinion, and I'll support the decision of the board. But my thoughts have changed since our last meeting. I'm still an opponent to wearing masks, but with this increase, I make the motion that we require masks for students in Ashe County schools until we can, at least for the first month. I'll just say we'll evaluate it at each of our board meetings, and hopefully can change back to optional at that time. So that's a long motion, but that's my motion.
I'll second that motion.
Okay, we have a motion and a second. Any other discussion or questions?
I would still like to see the daily, regardless of what the decision is, I want to see what's happening every day. I don't want to wait till a month from now. We may have to convene again and make other decisions. I'd like to see that continued. Just like we got tonight. That was the most helpful thing I've seen in this whole, whatever we call this, fiasco or whatever.
I was gonna say, last week we had very few at all.
Any
So
other
do I
questions?
need to amend that motion just to say we will call another meeting as needed, or just leave it on the floor?
That's fine. Do you second that?
I did second.
But he's adding to it if we need to change in between.
I'll second it. Yeah.
Okay, all right,
Oh, yeah.
very good. Any other questions or discussion? So we have a motion and a second on the floor. Mr. McClure, since you're online, I'll ask for your vote first.
Yes.
Ms. Jones,
Yes.
Chairman Roden, no. Vice Chair Eldred,
Not ready yet. Yes.
Dr. Simmons.
No.
Motion will carry 3-2. Does anybody have anything else? So the motion is carried. The schools will start with masks, be reevaluated as numbers change at the discretion of the board.
I would like for all the staff to become aware of whatever the final thing is about our quarantine. They may not be making those decisions, but they will be having conversations with families as well. So I would like for them to, I want us to do the least restrictive we can and.
Oh, this should change, right?
Yeah.
This
should
should
change.
this should
Should
change.
change.
We should go to a minimum, absolute minimal procedures for quarantining if we're gonna wear a mask. I absolutely feel that way. If we're gonna have to wear a mask, let's go to the minimum requirement for the quarantine. Not that I want to support. I'm only one vote. I go with the vote of the board, but
I think.
I could have, I leaned that way because of how strict the quarantine was in earlier conversation today, but we have to lift those guidelines to be more student friendly to get back into the classroom.
I will make that into a motion that we make the quarantine restrictions as lenient as we possibly can,
Maintaining, being safe.
being safe, but that we use those guidelines that are in the toolkit that are least restrictive for our students, and that probably influenced my vote to begin with. So,
And staff.
mhm.
But
students
still follow-
and the
but still,
staff.
You should put in there, still follow the Appalachian Health Guidelines.
Yeah, the CDC.
So I'm assuming that's in your motion.
Well, if the Appalachian Health is following the CDC, that's a given. Is it not?
But don't we have to follow Appalachian Health?
So it's, their Appalachian Health is following CDC guidance.
So it's the
on this,
same
but
thing.
we don't meet with the CDC, we meet with App Health on a regular basis, but they're the ones who issue quarantines, not us. But as far as a return to school or return to sport, there's some discretion there because there is a guarantee. You have in the guidelines here, you have to be able to have strict, what's the word, Jamie? Adherence to, oh gosh, there's a word. Strict adherence to all non-pharmaceutical interventions is what it says in here. So that would include wearing a mask, which you voted to wear a mask, but then practice social distancing as well after for 14 days after the last day of exposure. So that part is bolded. So if that's the case, that would be a student to self-monitor that. Or, football, you're not going to be, I love football, but football, you wouldn't be able to social distance during that sport, but you could come back to class if they had 6 feet of social distance. Is that correct, Jamie?
That's what we discussed earlier. So do we need to go over that again?
If both were wearing masks correctly during the exposure time and the close contact is asymptomatic, no quarantine. Right? Because we're all wearing masks. So if both people are wearing, right? I mean, that's,
And that has a big bearing on my vote because I want this less restrictive quarantine to ensure our kids are in school.
And I'm going to repeat your motion. It comes
Are we-
muddled.
We're not gonna change any of these, are we?
if we're not, yes, that's
Yes,
the
we
whole
are.
point. That would be the whole point.
I make the motion that we change these to be in line with the masking requirements in the CDC guidelines that are the least restrictive. Is that for our students and staff?
There's still variables there to what would be considered
We
least
won't-
restrict.
We won't, yeah. And we
Which-
will need to look at that again, I think,
Yeah.
after it's done.
Okay,
Not that I think there's a trade-off, but at least that would be a benefit to
Mhm.
having to wear a mask is that if both are wearing masks, if they're not looking at quarantine.
Mhm.
Is that correct?
Yes,
Both
ma'am.
the close contact and positive were wearing masks correctly during the exposure time, and the close contact is asymptomatic.
Right, asymptomatic, I think is the key word.
Yeah.
Okay, so I have a motion on the floor. Did you get that, Amanda?
I'll have to come back and look at the video. We can move on.
Okay. Do I have a second to the motion?
I second the motion.
Okay, so I have a motion and a second. Any other questions, discussion?
Should we vote on this before we rewrite it?
Well, they'll just be going by CDC policy.
They're just.
That's
gonna be
already
going-
written.
Okay,
It's already
that's all
done.
I need to know.
So, any other questions? All those in favor with Keith online, I'm just gonna go through the Keith, your vote,
Yes.
Ms. Jones,
Yes,
Chairman Rutten, yes. Ms. Eldred,
Yes,
Dr. Simmons.
Yes.
Okay, motion carries. To back up just a little bit, I do want us to clarify on the motion on the mask. Is this across the board? Is this adults? Is this visitors to campus?
what are they, everybody will test wearing visitors that you cannot enter the
Correct.
school.
well, we discussed earlier the possibility of adults not having to wear them if there's no children present, if they in their classroom or like vaccinated adults. I think that is important here too.
I was just posed that question. That's the reason. I think we
How
need
much
to
does-
clarify. Because
How
we got
much
a
does
little,
the
we got
virus
a
pop
little,
out in the room?
got a little iffy last time on the optional.
How long does it
cookies.
last? Does it come, if you cough or sneeze? I saw them, I can't remember how long, they had a diagram on Facebook, how much, how far it spread and how long it took to spread, how long it lasted. With just a simple sneeze. I can't remember all the details.
I think it should be optional for those adults in situation where they would not be impacting kids that have not been vaccinated. Is that a fair statement? And that would include visitors, unless they came to the school to meet with it. Just one person that, on a work day or whatever, that kind of thing. I think that we need to use some common sense on that one.
But it is for all employees, all adults, children, everybody. I just want to make sure everybody's clear on that.
I thought that's what we voted.
I'm just making sure. Last time we voted optional, we had a little back and forth just to make sure. I just want to make sure. So,
If we're going to require all the students to wear a mask, then we should require all the teachers and all the workers to require masks. I pity those, I sympathize with the ladies in the cafeteria. Do we have air conditioning in all of the cafeterias now? I think we put it in,
Not in the kitchens, in the dining rooms, but not the kitchens.
I thought we put the last one in at Mountain View, that they were the last school to get the air
I don't know,
conditioning.
it's still hot in there. I don't know if it's air conditioned or not, but I'm against, Paulette, against everybody having to mask up in every situation. I think there should be some leeway if there's not kids present, and if you're in your own classroom, you're gonna wear by yourself, you're gonna wear your mask, that kind of thing.
The idea that I'm trying to tell adults what to do,
does the motion say, how does I just want to clarify, how does the motion read on that? Not Diane's, but the one Keith said, does it say kids?
Motion require masks for students.
So it just, okay, that's what I had down on here. So the motion for mask that was passed said just for students.
Well, it should be for teachers.
Do we need to back up and amend the motion?
I don't think so.
I just want to clarify, I'm
No,
making
I
sure
don't
we've got
think
it.
so.
Because you could do another motion instead of backing up. if you
Yeah,
wanted to
You can do
separate.
another motion for adult staff or across.
And then you could clarify in that if they were alone in their classroom, you don't have to, or on work days when kids are not present.
I think it should be in the absence of students. that they should have a choice.
I just want to make sure, because that is how the motion, that's how I had wrote down on there that it said just the children.
We have given the adults the option of being vaccinated, and many of our teachers have to do that. And there are some teachers who cannot be vaccinated, but that masking should be a choice if they're not with their students. That's the way I'm looking at it.
Well, we will need a motion.
Well, I will make a motion that this masking does not apply to adults that are not around the children. In the absence of children, they have the option of wearing their mask or not.
So does that mean if I'm working in the kitchen and the cafeteria, I'm not serving food, that I can take my mask off?
That's what it means to me.
So you're saying as long as children are not present?
Yes, ma'am, sir.
Okay. Do I have a second to that motion?
I second the motion.
Okay, thank you, Mr. McClure. Any other questions or discussion? Hearing none, I'll ask for the vote. Mr. McClure,
Yes.
Ms. Jones,
I'm not sure what I'm voting for here.
I'll let you read the motion from the minutes.
Motion, mask does not apply to adults when
It's a little bit louder. I really can't hear you.
motion says that mask, the previous mask motion does not apply to adults when not around children. So if they're alone in their classroom or if they don't have kids present, they can choose to wear a mask or not.
Okay,
You in favor?
we can do that, yes.
Okay. Chairman Roden, yes. Vice Chair Elder,
Yes.
Dr. Simmons,
Yes.
motion carries.
Bus drivers would be off, they'd have to wear them.
Bus drivers were different.
Yeah, everybody, that's just only teachers, but I think visitors coming into the school now should have to wear masks. I'm sorry.
So the other question that I have, are we talking about indoor? Can we clarify that indoor? So I don't know whether you want children wearing masks on the playground or outside. So just to be clear, is this at all times on school property or indoor?
At ball games?
Yeah.
I mean, there's,
Oh, Lord have mercy.
sorry.
No,
But I mean, well, I got you here.
Can we control at ball games if they're there with their parents?
Well, you know, the guidelines say that they say that they have lifted the restrictions for out of doors. So if we're going to be consistent with the guidelines, you know, unless we see, I mean, we've left it open. If we see it's getting to be a big enough problem, we can always say we have to go mask outdoors. I think we should start off the least restrictive, and it's hotter than,
Yeah.
it's hot outside, and to put a mask on a kid when they're trying to exercise outside and they need to be outside, I think that is not in the guidelines. It's not recommended. I say we go at least just indoors.
Thank you.
It's dangerous.
That's how we'll operate then.
The heat is dangerous.
I just wanted to make sure
What
that
is-
that was clarified.
what does that say about outdoors? Does Jamie know?
I think it says it's not recommended outdoor, but we.
One young lady died.
It's not, okay.
Mask
I hadn't
outside.
seen. So.
I would have to check back through the toolkit to see what the latest one says, but.
So I guess,
Jamie, do you know?
It is not referenced in the newest. So I'm assuming that it goes by with what the CDC is recommending is the outdoors, no masks, but I will have to verify.
I've got it right here. It's actually, it was removed, that piece, recommending that everyone wear a face covering outdoors. So that was removed. So we will make sure that this is only applies indoor.
Mhm. So they have the option of taking their mask off at recess and at lunch. But
I
there's,
hope they take it off at lunch.
that'd be funny. But I mean, the month, I know they have to take it off at lunch, and that's a dangerous time, but outside should be good. They need to take it off they need to take it off during recess at lunch. They need a little break there during the day. I know it's hard to wear a mask.
Do we need a motion to say that
Yeah, I
indoors
just
or
want to
just
make sure
clarify?
that's what you, the motion says, does it say at all times, or does it just say students wear masks?
It doesn't say. Students wear masks in all
It just
classes.
says students require masks for students in Ashe County schools. And we evaluate.
But the CDC does not say.
It does not reference, it took the recommendation of outdoor off the table here. So if you're okay with that, we'll just operate that way. That outside is okay. So that should be safe since it's not in there.
So
So
we
it's following the
assume
CDC.
it would be while they're in the building, except at lunch.
Yeah, you can't eat with a mask on yet.
I guess you
I guess
could.
that's what it have to be.
Okay. So the motion will be basically for indoors only. On there. That is what with WCC, West Community College was doing. With theirs.
You can't get in over there. Man.
Yeah, just inside.
You can't get in either. Can't
Any
get-
other items to come
please,
from
no.
the board? Any other questions? Concerns? I'm getting several emails online while we're sitting here.
I am too.
Because their kids have to wear masks.
Or just options.
Well, right now, we are full for online currently, and we're ready to start school on Monday and have classes assigned. And the reasons why they were online was either for health of their child when it comes, some kids are vulnerable, or they have family members that are vulnerable. So we already knew who those were. And they had success online last year, or had success online last year. I hope that we'll send their children on Monday. We'll have to evaluate options, but right now, it would be really tough to open up another class for a couple of students. I don't know how many that is. And I know that it's difficult being in and out, so if it changes, are they gonna wanna come back into the classroom? We're trying to prevent that because we know where children learn best is in the classroom. We'll do whatever the board wants us to do, but it would be a challenge to move a teacher right now, another teacher to online to accommodate, and then have perhaps them not wearing a mask, or not wearing a mask later on, and then have that wanting to change. That was really tough on teachers last year and now. And tough on kids too. But I'll do it, we'll do whatever you guys want us to do to accommodate. I just know that would be, we're starting school, so it's kind of slim pickings on teachers to hire a new one. So we would probably have to pivot somebody who's already assigned to a classroom.
Some schools are having the teacher to do the online and the class at the same time. Stand up front and do the online and the class at the same time.
That is true. That is a model that's out there. That's very tough, but it is a model that's out there. And again, we will, whatever you guys want us to do, we will
Well,
figure it out on behalf of children.
teachers do
We're
not
gonna
like
do what
that.
we.
Teachers do not like that.
I'd like for directors and whomever's involved to be ready to move to a more strict kind of environment because I've heard talk that we'll be lucky, we may be in the same situation. I don't want us to be caught unprepared if we have to move to maybe the AB plan again. It may be coming if the numbers keep going up. And I don't want it to be that. I think it was awful last year. I don't want that but I want us to be ready for that. We're not ready for the quarantine, folks, so we need to start moving toward what ifs and making sure that we're ready for those guys.
Well, we will have, once Chromebooks are deployed, the storm yesterday put a wrench in that plan. So once those are deployed in hopefully the first week, we were able to do that in 1 week last year. So I'm sure that we can pivot again.
Mr. Chairman, may I make a motion that this meeting be adjourned?
I was just getting ready to do that.
Okay,
I second that motion.
all right. Any other questions to the motion of the second? All those in favor? Again, I'll just go around. Ms. Jones says yes. Mr. McClure?
Yes.
I agree, yes. Ms. Eldred?
Yes.
Dr. Simmons?
Yes.